As a healthcare provider, what do the DEA's proposed rules for permanent telemedicine flexibilities mean for you? The Drug Enforcement Administration, DEA, has recently announced proposed permanent rules for the prescribing of controlled medications via telemedicine, expanding patient access to critical therapies beyond the scheduled end of the COVID-19 public health emergency. The U.S. Department of Health and Human Services and the U.S. Department of Veterans Affairs developed the proposed rules along with the DEA. We aim to provide healthcare providers like you with a better understanding of the proposed rules and how they may impact your practice. The COVID-19 pandemic has accelerated the adoption of telemedicine to deliver healthcare services. However, prescribing controlled medications via telemedicine has been restricted by the DEA regulations, which require an in-person medical evaluation before a prescription can be issued. In response to the pandemic, the DEA has issued temporary exemptions to this requirement, but these exemptions expired at the end of the public health emergency. The proposed permanent rules aim to extend these telemedicine flexibilities beyond the pandemic while ensuring the safety of patients. Under the proposed rules, healthcare providers can prescribe a 30-day supply of Schedule 3 through 5 non-narcotic controlled medications and a 30-day supply of buprenorphine for the treatment of opioid use disorders via telemedicine without an in-person evaluation, as long as they have previously conducted an in-person medical examination of the patient. For other types of controlled medications, an in-person evaluation would still be required before prescribing via telemedicine. The proposed rules also provide safeguards to prevent overprescribing and ensure patient safety. Healthcare providers would need to follow any applicable federal and state laws, and the rules only apply to a narrow subset of telemedicine consultations. Telemedicine consultations that do not involve prescribing controlled medications, as well as consultations by a medical practitioner who has previously conducted an in-person medical examination of the patient, are not affected by the proposed rules. The proposed permanent telemedicine flexibilities can potentially improve access to critical therapies for patients, especially those living in rural communities who face difficulties accessing healthcare services in person. Healthcare providers interested in utilizing telemedicine to prescribe controlled medications should ensure that they comply with the proposed rules and any applicable federal and state laws. They should also be aware of the safeguards in place to prevent overprescribing and ensure patient safety. The proposed permanent rules for prescribing controlled medications via telemedicine can potentially transform the delivery of healthcare services in the U.S. Healthcare providers should take the time to familiarize themselves with the proposed rules and ensure that they are compliant, as this will allow them to take advantage of the telemedicine flexibilities to improve patient care. The DEA is currently accepting public comments on the proposed rules, and healthcare providers are encouraged to provide feedback to help shape the final regulations. Ready to expand your reach? Nationwide Medical Licensing makes the telehealth licensing process as simple as possible. To get started, call us today at 321-622-9030 or visit us at nationwidemedicallicensing.com.